We have people joining us for this Festival of Disruptive Thinking from all around the world. So wherever you are, thank you so much for coming to join us today. It's an absolute pleasure to have you all here. My name is Tom Hunter, and I'm your moderator for this session. The session is Treat the Patient, Not the Number. It's going to be absolutely fantastic. And before we start into the talk itself, for those not familiar with the Entrepreneurship Institute at King's, they believe that everyone can be entrepreneurial and that entrepreneurial people can help make the world a better place by solving problems to create a healthier, smarter, more equal and sustainable future. So today's session is Treat the Patient, Not the Number. We're going to be looking at questions like, how can we treat cancer more wisely? How can we select patients that will benefit the most from our treatment? How can we balance the positives and negatives when treating those patients? To answer those questions, and to share their research, I'm joined today by Dr. Rafael Torres Martin de Rosales and Jie Tang. Jie is a second-year PhD student from the School of Biomedical Engineering and Imaging Sciences, Faculty of Life Sciences Medicine at King's College London, and is funded by It's funded by EPSRC CDT in Smart Medical Imaging program, and she is the only international student who joined us in 2020, making you our superstar speaker today, Jie. Thank you very much. She graduated from Peking University last year, which is the most prestigious university in China, and her current research focuses on integrating PET imaging and drug delivery systems to improve radiotherapy. I'm glad to say that Dr. Rafael is equally impressive, but has a shorter bio for me to read to you. He is a reader from the Department of Imaging Chemistry and Biology. His research focuses on nanotechnology, and he's going to be sharing the stage today with you to talk to us about their research project. But I think you've had more than enough of me, and unfortunately you will be seeing me at the end for our Q&A session. So without further ado, it's my absolute pleasure to introduce you to Rafael and to Jie. Jie, the stage is yours. Looking forward to this. Have a great one.
Thank you, Tom, for introducing us. And please give me 1 minute to share the screen. And please let me know if you can see the screen.
That is all perfect. Looking great, Jie.
Great. So it's my pleasure to be here as a second-year PhD student. And first, I would like to invite my supervisor, Rafa, to talk about the motivations behind our project. Rafa, are you happy to talk about that to the audiences?
Thank you. So thanks, Jill. I just basically want to start with some scary statistics. And that is that 1 in 2 people in the UK will get cancer in our lifetimes. And sometimes this happens at a very young age. So this is why in this project, we focus on improving cancer treatments. So our motivation is to improve the treatment of cancer by using clever ways to deliver drugs to the tumors. And also importantly, to visualize using medical imaging techniques, how the anti-cancer drugs distribute throughout our bodies and how do they clear from our bodies. And also very importantly, if they reach or not the tumor. So if you get cancer, your treatment is likely to involve surgery. So this is to remove the tumors if it is well localized. Chemotherapy, which involves the use of drugs to induce therapy. And also radiotherapy, which involves the use of radiation to induce therapy. Sometimes we also use drugs to improve the effects of radiotherapy, the so-called radiosensitizers that Jill will introduce you in a moment. Now, there are some problems with these treatments. You're probably aware that both chemotherapy and radiotherapy come with severe side effects. These effects could be things like losing your hair, becoming immunodeficient, and so this is when your body is not able to react to infections, and many more. And one of the main reasons these side effects are happening is the fact that most of these drugs used today are delivered throughout the body, the whole body, and hence are affecting both healthy and cancer cells. The solution to this problem is to develop a clever drug delivery system that we call DDS in this presentation, and that will minimize the exposure of the drug to healthy cells and to maximize the delivery of these drugs to the cancer cells. You can think of these drug delivery systems as a box where we package our drug so that it can be safely delivered by mail to its destination. In our case, the destination is a tumor. And also we want to package this box to not lose any of its contents during the trip. And in this case, this will be the healthy organs. The second problem with the current chemotherapies is that we don't know their fate inside our bodies. So the question is, where do they go? I'm sure that you all agree that you wouldn't like to take a new drug that is going to accumulate and have a toxic effect in organs that shouldn't be affected. So for this reason, we want to label our box, or DDS, with a beacon so that we can see where is it going, and help us select the box that will deliver most of the drug to the tumor and not the healthy organs. So the main hypothesis of the work that Jill and I are doing, and that will be the basis of this presentation, is that we think that by using a clever box that delivers specifically the drug, in our case, we say radiosensitizer to the tumor, and this will allow us to develop a very efficient treatment for cancer, minimizing the side effects of the drug and maximizing the therapeutic effects of the drug. In addition, we also strongly believe that by using these beacons, by seeing where the box goes inside the bodies, and by calculating using this beacon how much of it accumulates in the destination, in our case the tumor, we will be able to provide personalized treatments for patients that will improve the therapeutic effects of the drugs even further. So with this, I will now pass the presentation to Jill, who is going to describe you the project in more detail.
Thank you very much, Rafa. It's really interesting to know the motivations of our project. And now I want to ask you a question. How many of you have watched the hit series, The Breaking Bad? Well, in short, it's about the story of the drug dealers. Questions arise such as, from who can one get a reliable source of drug? Well, one source will be J.C. Pinkman, who has proved to not always be reliable. And another person to approach is Walter White, who ended up on the most wanted list by the DEA. Well, without a reliable source of drug, I would assume a hard time for those drug dealers. And more interestingly, if now we activate a sleeping DEA agent, say Hank, what would happen? Well, we can definitely speed up putting those drug dealers behind bars, right? Well, in a hugely similar way, we're trying to do the same thing in my project. Cells differ from healthy cells in a source that protecting those cells from DNA damages, namely BRCA protein, doesn't always prove to be reliable, just like JC. But that's okay, because we still have another pathway involving in DNA repair, namely PARP here, just like Walt, who is hard at work. But if this is a cancer cell, we definitely want to get rid of it, right? So here is an easy way to do that. We can inhibit the PARP. And by doing so, I would assume a hard time for those tumor cells surviving, right? And more interestingly, if now we activate the sleeping Hank, here the radiation, which can induce more DNA damages that can't be repaired, we can speed up the death of the cancer cells. Now, let's meet the star of this project. Its name is olaparib. Olaparib is the very first PARP inhibitor drug in the world. More than that, it's an extra hand for the radiotherapy when treating tumor. For example, it's also known as the radiosensitizer because both of them can induce DNA damages that can't be repaired. And olaparib has been used in many types of cancer in the clinic, so it's really popular. But it's not a perfect choice because olaparib itself doesn't target at tumor specifically. It would distribute throughout the body. And now let's think of this. Would you take medicine for a part in your body that is healthy? Probably not, right? I know I wouldn't, especially when the medicine had side effects. But unfortunately, healthy organs in cancer patients are affected every day. That's why people receiving chemotherapy tend to feel very tired, vomit, or even lose hair. Pretty bad, right? So what if we can just deliver drugs into cancer specifically? I'd say yes, please, but how? Now, in order to achieve that goal, we need to solve 3 questions. First, we need to dissolve it in water. And second, we need to help it escape from the watchdog. And finally, we can deliver the drug to tumor cells specifically. Now, let's dive into these 3 questions one by one. First, when a drug is given as a pill, more than 17% of it is wasted after you swallow it with a glass of water. But we can use the drug more wisely, as long as it can be dissolved in water. So that in that case, we will be able to inject the drug into a blood vein, and 100% of it will be used. However, olaparib doesn't dissolve well in water. So is this the end of the world? Not actually. We can package it up in a box that is happy in water, so that the real property and the real chemical and the physical properties of the drug can be hidden up. In this case, the solubility of the olaparib can be increased significantly. And second, we have a watchdog in our blood that will be on the lookout for harmful stuff constantly and then remove it from our body. So whenever a drug is given, is injected, it will be cleared within 30 minutes. But if we can help the drug to escape from this watchdog, it's possible that we can prolong the time of the drug staying in our body. How can we do that? Well, after we have put the drug into a box, if now we seal the box with a tape that can't be recognized by the watchdog as a harmful stuff and let it go, then we can buy the drug some time. And the tape here that help us seal the box is also known as the pixelation in this project, which is a surface modification, so that we can hide it and prolong the time of it staying in our body. And finally, I want you to imagine the blood vessels surrounding cancer cells as a pipe. It's interesting that this pipe has tiny holes in it, and medicine within certain sizes can leak via these holes, so that cancer cells can grab it and hold it in place. However, it won't happen to healthy organs. Why? Because the pipe is intact there. In the first stage of my PhD project, I will make nanoparticles with olaparib inside. Now, let's look at how big the nanoparticles is. Well, if you take a single hair from your head and you imagine something 1,000 times smaller than that, then we are talking about nanoparticles. Well, let's look at how it looks like here. If we put the rat drugs inside a box and then seal the box with the blue tape, then we can make the nanoparticles. And we made the nanoparticle with the polymer PLGA because the PLGA is quite safe. It's already using in human, and the PLGA can box water-insoluble drugs like olaparib. And we made these blank nanoparticles. It looks like a cloudy suspension in real life. And it will be like this under the microscopic view. And we tested how stable the nanoparticles is over time. And we noticed that the size and the size distribution didn't change over 2 weeks in water. So it's happy in water, which means it will be a super box for our drug. But hold on a second. Can I really count on the leaky pipes for all patients? Not really. Why? Because this phenomenon differs from patient to patient. For example, some may have larger holes or unusually many holes in the type, while others don't. And this brings me to the second stage of my project. What if we can attach a tag to the drug that lights up the drug, so that we can know where the drug goes in the body? And here in this project, we choose a radioactive tag that can be detected by PET imaging. And PET imaging works by 2 detectors collecting the radioactive rays around the patient. And PET imaging has several advantages compared to other choices. For example, it's really sensitive. And second, it can provide quantification for the tag. And also, it only requires tiny bits of the compounds, so it's relatively safe. Now, let's look at how a PET imaging looks like in real life. So actually, we can see all the details, like the brain, like the liver, and the heart, very clearly using a whole body PET imaging. So this is the reason we choose PET imaging. And in this stage, we will be able to show the leaky pipes. And whenever there is a lot of drugs that makes it to a tumor cell, we show it in red. And when there is only little, we show it in blue. But how does this different colors help? What does this information tell us? Well, keep that questions in mind for a moment, and I'll come back to it in a minute. Now let's try to be a chemist for a minute, and let's meet a radioactive version of olaparib. Could you find the difference between these three structures? Well, by changing the structure of olaparib a little bit, we can attach a radioactive tag to a drug. But before that, we need a non-radioactive version of the olaparib, which is the reference compound. But why do we need a reference? Because in this way, we will be able to avoid the handling of radioactive stuff as much as we can. For example, many characterizations of the drug would take a long time. But if we have a non-radioactive and a chemically identical compound, then we will have more time to do those fancy measurements. And you can even show off in front of your friend if you have a reference compound. For example, if we characterize the reference compound by HPLC, a method which is quite similar to what you've done at school, the ink chromatography, and then we will know how much drug the nanoparticle can carry as a payload at any one time. And at the final stage of my project, we want to use the information provided by the PET scan, and we can sort out the leaky pipes based on different colors. And for the following radiation, we can adjust the doses for each patient specifically. Treat the patients, not the numbers. In this way, I will make effective drugs while reducing side effects. And I thank all the people in my lab. And now, I want to ask you another question. Why do you do a PhD? So at the moment, what kind of reasons come to your mind? Natural curiosity? Being obsessed with becoming Doctor Who? Or the destination for a nerd? Well, in my case, one of the reasons I choose to do a PhD is because I can talk to people. As a result, I spent most of my time in the first year attending as many public engagement events as I can. Now, let's have a look at how I wasted my time. Firstly, I was invited to this event because someone remembered my 3-minute thesis. Well, I explained my project in 3 minutes to lay audiences. As you can imagine how many times I practiced as an international student. Not only I have to overcome the language barrier, but also I have to overcome the cultural difference. And even more than that, this was my first time studying abroad. And I started by self-quarantine for 10 days and then national lockdown for forever. And 3 minutes wasn't the only chance that I can talk to people at King's. I also organized the postgraduate research symposium this year. And we invited the external speakers by emails, which was the most exciting part in this event, because I would never have the opportunity to contact such prestigious people in my whole life if I didn't organize this event. However, it turned out that people with such big titles were just normal people, not so excited, right? And people from King's weren't my only audiences. I also speak to teenagers at school who felt interested in science and how scientists all look like. Obviously, we are not all nerds, and the teenagers should be aware of this truth, right? So in this STEAM week, we organized together with the Westminster Council. We talk about our career path and answer the questions from teenagers. Another event that's similar to this one, which is also aimed at teenagers, is the New Scientist Live event. I wasn't sure how many people visited our channel at the day, but I knew the total number was around 300, which is so exciting. I was speaking to such a such a big group. And not only did I speak to teenagers, I also spoke to children. For example, in this art and science event that combines artists and scientists to create inspirational art pieces. So my job was to explain the story behind this to the visitors. What do you usually find at science museum? Children, right? The most wonderful creature in the world. So, as I was funded by the CDT, I would also want to mention my experience at the CDT. So, CDT is funded by the EPSRC, and here I can definitely find the most supportive environment. For example, I've noticed a huge difference between the CDT and my previous experience because here you can always have the opportunity to find out what you really want. Like you have the chance to talk to people who work at industry. And also, I think everyone who had an open mind will fit well in the CDT because here you will always find something new in the research field where you are a beginner. But don't worry, you are never alone because you will have a load of great people to help you out. And in my mind, the diversity valued a lot because whenever you finish your PhD, you will find that everything outside science that seems to be unrelated to your project matters a lot. And that will help you locate a job and find a career. And I've talked about why I do my job. I would want you to think about what's your reason to do your job. And I'm happy to take any questions. Thank you.
Well, thank you, Raphael, and especially thank you, Jie. Your enthusiasm for sharing your research and your personal story towards that research is hugely inspiring. So thank you both for your sort of time to talk us through that. This is the opportunity for questions. So for anyone in the audience, as I said, please feel free to put questions into the chat and we'll get them. I don't see any at the moment, which means Raphael, Jie, you're in my hands. I get the questions until someone else takes the wheel, so I hope that's okay. I've got quite a few questions to talk about the research, but I hope it might be okay actually to talk a little bit about public engagement first. Would that be okay? Because Raphael, you said it's a common statistic, 1 in 2 of us will potentially experience some form of cancer and cancer treatment within our lifetimes. So it would seem to me that the public engagement around that is an absolutely crucial part of the research that we're doing. They're integrally linked in some ways. And I was hoping, Jie in particular, you could talk about your experiences and how that might have informed the research that you're doing. And Raphael, of course, please feel free to pick up on as well. But I think Jie first, if you wouldn't mind, tell us about your public engagement experience.
Yeah, I value those chances, those public engagement a lot because as a first year student, I actually don't know where to go in this project because in science, you always have the flexibility. You don't know where your directions is whenever you you have different choices. So when I attend the 3-minute thesis as a beginner, I haven't gotten any data, and I'm just totally a freshman, and I need to practice. How can I explain my whole project, the idea of it, to the lay audiences? So I practice with my landlord, with the daughter of my landlord, and also my flatmate. They are absolutely have no knowledge about science, and I try to make them understand what I'm doing. So so that during that practice, it become clear that what I want to achieve, the direction becomes clear to me, because they care about how the project will make a difference in their life. And I mean, only if you got the chance to talk to the people around you, the lay audience, then you would be able to know what you want to achieve in your project. I think that's the power for the public engagement. For scientists, it's really great to participate in public engagement, and also for the lay audiences, they will find, wow, science is so interesting, and scientists are not all nerds. They are just normal people, and they can explain their work in a vivid way. So I value that a lot. Rafa, how do you think?
Yeah, I completely agree. Perhaps I would also add that I guess scientists have the duty to, try to communicate these complex concepts and projects to the public. Firstly, because they're the main beneficiaries of it, but secondly, because it's been, most of it is funded by public money and funds. So it's definitely something we need to keep in the back of our minds. If the language that we use is so difficult and complex, that they don't understand how it may impact the life of people, then we have a problem there. So definitely worth it, the effort, and also it's a good, it's good both ways for both the scientists and the public in general. Yes.
Of course. I mean, it sounded like you were describing basically a positive feedback loop where your research is being informed by your engagement with the public, which helps you clarify and choose the routes forward and take you on to that next step. Would that be a good summary of?
Yeah, definitely, because it helps me to understand my project better, because at first I just have a rough idea what I want to do, just like the title of my project. And after practicing with different people, and I have to dive into the questions more specifically. Because if I don't understand the question, I would never be able to explain that to someone else. So that's why I think it helps me a lot.
Fantastic. Okay, so we're going to delve into the research a little bit now. So not to put you to the test, but I think let's talk a little bit more specifically about the research itself, if that's okay. So olaparib, am I saying that correctly? Olaparib? Yeah. Olaparib. Okay, so a question for you: if that only affects cancer cells with the BRCA mutations that you were describing, can you talk to us about why that's also having side effects on healthy cells? I think that's someone everyone in the public would like to understand. If it affects cancer cells with mutations, why is it also affecting healthy cells?
So that's a really interesting question, because as we can see in this slide, only in BRCA mutated cells the olaparib will play a role, because it inhibits the only pathway for the cells to repair legitimate damages. But we've noticed that olaparib also works in aggressively like white type cells that doesn't have the mutation of BRCA. We noticed this. It's possibly because in the rapidly growing cancer cells, the chances of DNA damages are higher than healthy cells. That's why it can also play a role. Then it should be the case. Like we also have a lot of rapidly growing cells in our body as a healthy cells, like the hair, like the bone marrow. That's why it will also have the side effects. And as I mentioned, the olaparib doesn't target at tumor specifically. So whenever we give the chemotherapy, there is some side effects that will affect the healthy cells. So I think it's not a perfect drug. We need to modify on that so that it will treat the patient more wisely.
Oh, fantastic. Thank you. I have a follow-up, as you probably anticipated, but I mean, just to say again to anyone, I'm quite happy to ask a few questions. I've been paying close attention, but you're more than welcome to take the wheel, as I said, and put a question into the chat. It's entirely up to you. But let's keep talking about olaparib, Jie, if that's okay. So what role does it play in this particular project? Is it a cancer drug? Is it a radiosensitizer? And I think for me, as a member of the public, perhaps you could also clarify those actual distinctions there. I just hear a brand name or a drug name, Olaprib, and what role does it play? And could you clarify the difference between a cancer drug or a radiosensitizer for us?
So I think in this project, it's definitely a radiosensitizer because we'll combine it with the radiotherapy, and both of them can induce the DNA damages which can't be repaired. So it's definitely a radiosensitizer. But if the death of the cancer cells is only caused by the radiosensitizer or the olaparib-based cell as a monotherapy, we need to conduct experiments to figure that out. In this case, we can set up different groups that have different treatments with the same type of cancer cells. We can have the olaparib only group and the radiation only group, and then combine them together to see how does the radiation play a role in this process. So we can plan experiments to answer that questions. Rafa, do you have anything to add?
Not really. I think one of the good things about olaparib is that again, it's got what you mentioned, these two effects as an anti-cancer drug, but also as a radiosensitizer. We believe that the combination therapy is probably the most appropriate one because its use as a radiosensitizer involves lower doses. If using our drug-to-lead resistance, we can maximize the amount of olaparib that goes into the tumor specifically, then we're talking about potentially using very small doses of the drug, hence low side effects and maximizing therapeutic effects, and probably in combination with the radiotherapy even better. So it's just an exploratory project. We're going to have to look at the different combinations and find the best one with the ultimate goal of having the most effective, safe therapy.
Okay, fantastic. And perhaps, I mean, this is a question for both of you. We're obviously using PET scan within this project. Again, from that public engagement perspective, how safe is PET in terms of human usage? It's obviously going to be a big concern for a lot of people. Is this project helping make that safer? Are there things that we should be explaining to our patients when we say treat the patient, not the number, to make sure that they're with us on this journey and can understand this quite complicated science that we're doing with people? So to summarize, how safe are we within the sort of the PET scanning environment, and how can we best explain the treatments that we're doing, even if there is an element of risk involved?
I think I can answer that question. So, so it's a good question, and it's completely understandable that people maybe are afraid of having a radioactive substance being injected into the bodies. I think just to kind of calm these worries, I think people need to be aware that these sort of techniques have been used for many years in hospitals, and they're highly monitored, and we only use radiation doses that are safe to be used. So there are departments within the hospital, the medical physics departments, that will be able to calculate what the dose should be administered for a specific patient. So it is done, it's not done in a kind of random way. It is done in a very controlled way. I guess to answer your question, can we kind of communicate this to people? I think it's just by doing just public engagement and making people realize that radiation has this bad side. Thinking about nuclear energy and disasters in that area, or the use of radiation and its role in inducing cancer, but it can also be used to cure cancer. In both ways. One is by using it to treat cancer, and the second one is to use it to diagnose cancer. So I think just by showing people the bright side of radiation and communicating that well is a very important step towards that.
Oh, that's fantastic. Thank you. I have a follow-up question. Perhaps this is one for you, Jie, for the research. We're talking about radioactive tags here specifically, but can we attach a tag to the drug that is not radioactive? Is that something we've explored?
Yeah, that's also a good question. As we can see in this slide, the radioactive tag is just change the structure of olaparib a little bit. If we don't use the radioactive tag here, we can also choose a fluorescent tag, which won't have a relatively big structure here. And with that bumpy structure, it might change the property of the parent drug. But in my project, I want to track the drug inside our body. So I want to make sure the structure is as similar as possible to the parent drug. So if you attach another, like say, fluorescent dye that is non-radioactive, it has some trade-off. For example, firstly, it will change the structure of the drug. So maybe after the tag, the drug doesn't behave the same way as the parent one. And second, fluorescent, like the optical imaging, has several disadvantages compared to PET imaging. First, it's not a quantitative way, and also it requires a larger concentration to detect that signal, so it's not really sensitive, and the light can't really travel very long through our body because it will be scattered by water, by the tissue. So you can only detect the superficial signals, but PET won't have that issue. So you can choose a non-radioactive tag, but there are some trade-offs for that.
Brilliant, thank you. And back to help me say it again, please. Olaparib. Sorry about that. Right. So, how safe is that to keep in our body? Can it stay in there for a long time? We're talking about it being in there. Could you let us know? I mean, what safety is obviously something we've touched on several times in this talk from a public's perspective. So how safe is it to keep it in our bodies for a period of time?
Well, I think yeah. Go ahead.
No, I was going to say, something to bear in mind is that olaparib is used, in patients, in many patients a day. It's a safe drug. It's got disadvantages that we described in terms of, how bioavailable it is and how soluble it is, and we can improve it. But it is a safe drug. It's been used in patients, and what we are trying to do is to even lower the dose that we will be administering. So I think it's safe to say that it is a safe drug used within the current recommendations.
And also, I want to add that the nanoparticles we choose is also relatively safe because all of the components we choose to make this nanoparticle is approved by the FDA. It's degradable, it's injectable, and it won't stay that long to have a side effect to the healthy organs. So for example, the free drug might stay in the body for within 30 minutes, and the nanoparticles can stay inside our body for up to 72 hours. But longer than that, it will degrade it through our body. So it won't have side effects on its own as a blank nanoparticle. So the olaparib is relatively safe, and the components for the nanoparticles are also safe. So I think the safety issue won't be a big problem.
That's fantastic. Thanks. So I've got a couple of last questions. I'm not seeing anything come into the chat because I think we're talking about some quite serious research here, and I think everyone's listening intently, as far as I can tell. So again, a fantastic example of public engagement, Jie. Your leaky pipes analogy, the leaky hose slide that we were talking about there. Is that leaky pipe something that's true of all cancer cells? Is it a particular kind of a particular manifestation of cancer that demonstrates that attribute? Yeah, there we go. There they are. Is this something that we would see as typical of a cancer, or is it specific?
Yeah, so we observe this leaky pipe. We call it EPR effect quite often, and we observe this effect in all the tumor-bearing animals, but that's not the case in human because of the heterogeneity. So far, we didn't have many nanoparticles approved by the FDA. I think, in my mind, that's because the heterogeneity of the EPR effect in human, some may have like a huge, like this one. Some will have this kind of leaky pipe. Some may have this kind of. That's why the two people receiving the same treatment will have different response, will have different therapeutic outcomes, and that's why. That's also the reason why we want to track the nanoparticles. We want to show how the leaky pipe is inside our body. So it's quite a specific phenomenon in each patient. That's why we need to realize the personalization treatment.
Fantastic, thank you. So I've got one final question, if I may. It's going to be for both of you. Raphael, I'm going to ask you to go first, if that's okay. So we're in the Festival of Disruptive Thinking, and I thought let's finish a little bit thinking about thinking, if that's okay. So we're talking at a PhD level of study here. We're talking about medical technologies on the cutting edge of what we know within science. Raphael, perhaps you could talk to me a little bit for anyone who's considering joining us in the School of Biomedical Engineering and Imaging Sciences in this adventure, and how you would kind of assist that kind of entrepreneurial thinking, creative thinking, out of the box thinking, whatever we want to call it. How are we set up to kind of support that kind of exploration of these new medical technologies? And Jie, obviously you've been here with us for a little while now. I just like to close up with just your sort of experiences a little bit more as you've been with us. What have you learned? Is the PhD what you were expecting? You went through a lot to get here to us. So well done. So a huge amount for kind of like going through lockdowns and quarantines and everything like that. It would just be fantastic to see, where you were then, and perhaps how that's, this process has affected your thinking and your experience with us. Raphael, if I could ask you to go first. I'm noting that you're muted, so just there we go.
So I think, we are in the department of a School of Biomedical Engineering and Imaging Sciences, and engineers try to solve problems, but I'm not an engineer. So I'll tell you a little bit about, I guess, how people can, scientists, basic scientists can find a home in this sort of school and projects. So I think anyone who is interested in solving healthcare issues using the basic science knowledge, and people who are really interested into solving problems, finding solutions from different disciplines. I think this is kind of the basic, the person that kind of will enjoy working here. So in my case, I'm a chemist. I'm good at making molecules, and I always had an interest in using these molecules for something useful. In this case, it's healthcare and medicine. And I guess it's similar to Jill, where she wants to develop new drugs and new treatments, and she's introducing new concepts like imaging into her interest to help her solve these problems. So I think this is a very interesting environment for anyone trying to expand, the basic knowledge into scientist knowledge and basic sciences or otherwise. And they need to be happy to listen to others and try to have a very clear idea what is the problem to be solved. And this should be driven by both clinicians and patients. Yeah, I think it's more like it would be how I would describe someone who can really develop here. In terms of PhD, I think that's what you, Jill, are basically looking to do, isn't it?
Yeah, I quite enjoy this experience because it makes me love my job even better. Because when I can explain my project in 3 minutes or 1 minute to someone who are not familiar with this field, I feel really proud of myself, because people will not, and people will show interest, and you will think your work has an impact to the day-to-day life. So I think the public engagement just makes me love my job. And also, it can inspire other people, like the teenagers. For example, I attend the events that aimed at teenagers. When they knew how scientists are look like, how they work, what does it like a usual day for a scientist, they would have a better idea, and that might inspire them to become a scientist in the future. It's not something that they are not familiar. I mean, they will have a clear idea how it will look like. So I think the public engagement just matters a lot, both to the scientists and the lay audiences. Yeah.
That's fantastic. Thank you. Thank you both. This has been a hugely inspirational session today. I feel like I've not only learnt lots, but I'm inspired to go out and keep learning more. And Jie, this is amazing work that you're doing, taking us forward into the next level of cancer treatment. So thank you so much for your contribution as well, to both of you.